I want to just spend 3 minutes or so to outline one of the critical components of my sectoral linked to COVID, where we spoke about the need to develop a management plan or a plan to treat with COVID. And, we are moving into a phase now where we are moving from making as a primary effort using significant restrictions, keeping COVID out of Jamaica. Clearly, COVID is here. And there was value in significant restrictions to keep the virus out, the restrictions at our air and seaports, so that we could prepare ourselves to deal with it because we felt it was inevitable, as it is the case with all other countries. Now that we are at a place where we think we have prepared our hospital infrastructure, we have over 350 or so COVID beds, we have gotten the ventilators in, we have trained staff where necessary. And the fact is, life also has to go on. We have diaspora members who have been out on vacation who need to come back in, others who have relatives here who depend on them, who have to come, business people who have businesses here and of course have to look about their business. We're a very open economy. And then finally, of course, the tourism interest, those who will come for rest and relaxation. The dynamics of managing the COVID risk has to be borne in mind in the context of easing of restrictions, not to mention internal restriction easing, people wanting now to go back to church or to wherever, work, etc. And so the ministry has been working on a plan in recognition of living with COVID and the risks that are associated with that. And we're going to be unveiling more details around that plan, but I did speak to it, outlining that living with COVID means, first and foremost, that we always have to be cautious. We cannot let our guard down. As I like to say in parochial terms, COVID's still a keep, and therefore people must not ever get complacent, despite the successes that we have had. But secondly, there are some specific things that we have to do and are doing contained in that plan. These include a review of the existing legislation to bring them in alignment with international health regulations, requirements, and the drafting of policies that support infection prevention and control measures at home, in the communities, and at the workplace. So it's a review of the process that clearly reinforces the general messaging that we have been pushing around: physical distancing, wearing of masks, sanitizing, cleaning surfaces, and this is going to be the new standard operating procedure, the new normal that we like to call it. The Strategic and Human Resource Review of the Health Emergency Operations Center, EOC, we're here now at the physical space, to increase the capacity to respond to multiple and varied disasters, and the documentation of EOC procedures. So we need to always be ready for a health emergency. It doesn't have to be COVID or COVID-like. It could be a hurricane, it could be a earthquake, it could be many other forms of emergencies, dengue or otherwise. And COVID is requiring us to upgrade and to review.